Welcome to day 551 of COVID coverage for St. Clair County. Today we have Mila Blanford with us from the Health Department, who is the Executive Director for our numbers. Mila?
Thanks, Sam. Good afternoon, everybody. For the reporting period of September the 9th through September the 15th, we have a total of 540 new positive tests out of a total of 9,348 for the reporting period. The age range of individuals is under 10 to in their 80s. The weekly county positivity rate is at 5.7%, with the 7-day rolling average match at 5.7%. The regional positivity rate as of September the 12th was at 6.9. Unfortunately, we have 2 new deaths to report today. We have a male in his 40s, a male in his 70s, a male in his 80s, and an additional male in his 40s with unknown health conditions. We have a female in her 50s, a female in her 60s, and 4 females in their 70s with known and unknown health conditions. Countywide, we have conducted a total of 454,659 tests, consisting of 38,339 positives and 416,320 negatives. The total number of deaths to date is 528, and our condolences go out to their families. To date, the number of individuals who have completed their 10-day isolation period is at 36,956. Statewide, we've tested a total of 30,193,211. The total positive of that number is 1,582,392, which is an increase of 28,056 from last week. Total deaths to date is 24,451, which is an increase of 257 from last week. For St. Clair County hospitalization numbers, we have 46 patients in St. Clair County hospitalized with COVID-like illness. Regionally, we're at 112. Patients on ventilators in St. Clair County is 8. Regionally, we're at 15. And again, this week, our hospital has been able to provide us with a graphic. We can see that we have 40 unvaccinated out of 46 that are hospitalized, so about 87% are unvaccinated. We have 13 in the ICU, 2 of which are vaccinated, so that's about 85% that are unvaccinated. We have 8 patients on ventilators, 0 of which are vaccinated. Okay. And we'll go to the age breakdown as well. We can see that right now we have about 60% are under the age of 40 for positive cases in St. Clair County. About 36% are under the age of 20, and about 19% are under the age of 10. We also know that we have predominantly the Delta variant in St. Clair County, comprising about 81% of the variants reported to St. Clair County Health Department, and the Alpha variant is about 18%. So again, we're seeing that age shift to the younger age groups. And the American Association of Pediatrics has announced that we've received a 240% increase in pediatric cases since July across the nation. So it's not only here, it's across the nation that we're seeing those increases. Okay, we'll go to congregate care for those in outbreak status. Caseyville Nursing and Rehab, we have 2 new cases. Cedarhurst of Shiloh, 2 new cases. Freeburg Care Center, 1 new case. Integrity Healthcare Belleville, 1 new case. Mercy Rehab, Swansea, 1 new case. And St. Paul's Home, 1 new case. Again, we offer testing at multiple locations in St. Clair County. St. Clair Square offers not only testing, but also vaccine, all 3 types, Monday, Wednesday, Friday, and Saturday from 8 to 4. There's testing options at CVS, MedExpress, and Walgreens. We offer vaccine at 330 West Main. If you have any questions, you can call the Health Department Monday through Friday from 8 to 3:30, 825-4447. We're also offering that 3rd dose for those who are moderately to substantially immunocompromised. We offer that at 330 West Main, as they do at St. Clair Square, and a variety of other providers who offer vaccine. I know there's been a lot of questions lately about the booster doses that may be being approved around September 20th. On September the 17th, the FDA has a meeting, and at that point, right now they're looking at Pfizer, and they will authorize or not authorize the use of that as a booster dose. And then on September the 29th, ACIP meets, and then they make their recommendation to CDC. So you can go on CDC's website, you can watch those virtually. If you need more information, you can go to the Health Department's website, as well as our social media. We have a link out there to a CDC page that explains that whole process. We've also received some questions about the J&J dose, and right now there's not as much data on J&J. As you remember, J&J was released later in the spring, so there'll be more information to come on that particular vaccine. Okay, Samantha?
So now we will go into our zip code reports, and I'm sad to say we only have one zip code that does not have any new changes. 62201 is at 773, which is an increase of 5. 62203 is at 872, which is an increase of 14. 62204 is at 573, which is an increase of 7. 62205 is at 908, and that is an increase of 22. 62206 is at 1,907, and that is an increase of 27. 62207 is at 907, and that is an increase of 14. 62208 is at 2,199, which is an increase of 26. 62220 is at 2,735, which is an increase of 33. 62221 is at 3,641, which is an increase of 53. 62223 is at 2,317, and that's an increase of 27. 62225 is at 228, and that is an increase of 4. 62226 is at 4,153, which is an increase of 67. 62232 is at 1,124, which is an increase of 18. 62239 is at 628, which is an increase of 9. 62240 is at 225, and that is an increase of 5. 62243 is at 933, which is an increase of 7. 62254 is at 948, which is an increase of 7. 62255 is at 130, which is an increase of 5. 62257 is at 447, which is an increase of 10. 62258 is at 1,401, with an increase of 16. 62260 is at 944, which is an increase of 10. 62264 is at 467, which is an increase of 10. 62269 is at 4,242, which is an increase of 50. 62282 is at 83, which is an increase of 1. 62285 is at 699, which is an increase of 7. And finally, 62289 is at 60, which is an increase of 1. As Mila said, there are multiple options for testing and vaccine options. And if you have any questions, please don't hesitate to reach out to either EMA or the health department at 825-4447. And we will see you next Wednesday for new updates.